The discussion began with Ellen asking about retirement and second careers. She was highlighting people who had found new purpose after leaving their original professions. A former accountant who became a school crossing guard, a retired firefighter who now taught safety classes to children. She'd already talked to a former engineer who had started building playgrounds and a retired nurse who volunteered at animal shelters. But when she noticed a woman in row 7 who had the careful, attentive posture of someone accustomed to handling important details, she had no idea that the next few minutes would reveal one of the most selfless and heartbreaking stories of medical compassion she'd ever encountered. "Ma'am, you have the look of someone who worked in healthcare," Ellen called out, pointing to a woman who appeared to be in her mid-50s. "Were you a nurse or doctor?" The woman stood up with the precise movements of someone who had spent decades being careful and methodical. She had silver-streaked brown hair, intelligent blue eyes behind reading glasses, and the kind of calm demeanor that suggested years of helping people during stressful situations. "I was a pharmacist," she replied, her voice carrying the clear, measured tone of someone accustomed to explaining complex information. "I'm Linda Stevens, and I worked in community pharmacy for 32 years before retiring 2 years ago." "Linda, 32 years as a pharmacist, that's quite a career. Are you enjoying retirement?" Linda's expression became more complex, carrying both satisfaction and something deeper. "Well, I'm not exactly retired from helping people get the medications they need." Ellen tilted her head, intrigued. "What do you mean?" "I still spend a lot of time at pharmacies, but now I'm on the other side of the counter, helping people who can't afford their prescriptions." The studio audience was paying attention, sensing there was more to this story than typical volunteer work. "How do you help people who can't afford their medications?" Linda paused, seeming to consider how much to share. "When I see someone at the pharmacy counter having to choose between their medications and other necessities, I step in and cover the cost." Ellen felt her interest sharpen. "You pay for other people's prescriptions?" "Yes. I've learned that medication compliance is literally a matter of life and death for many conditions. When people can't afford their prescriptions, they skip doses, split pills, or go without entirely. That can be fatal for diabetics, heart patients, or people with other chronic conditions." The studio began to quiet as people understood the gravity of what Linda was describing. "Linda, how often does this happen?" "More often than most people realize. I spend time at 3 different pharmacies in lower-income neighborhoods, and I see it every day. Elderly people on fixed incomes, working families without good insurance, people who have to choose between medication and rent." Ellen made a decision that would transform this conversation into something much more profound. "Linda, would you come down here and tell us more about this?" Linda made her way down to the stage, and Ellen noticed how she moved with the confident precision of someone who had spent decades measuring exact doses and understanding the critical importance of accuracy. Once they were seated in the interview area, Ellen asked the question that would reveal the full scope of Linda's post-retirement mission. "Linda, you said you help people at 3 different pharmacies. How long have you been doing this?" Linda looked down at her hands. "About 18 months. Since shortly after I retired. I started noticing the problem when I was filling my own prescriptions, and I couldn't ignore it." "What was the first situation that made you decide to help?" Linda's expression became more emotional. "There was an elderly man named Roberto, diabetic, trying to fill his insulin prescription. When the pharmacist told him the cost, he just stood there for a long moment, then said he'd have to come back next week when his Social Security check came in." Ellen leaned forward, understanding the implications. "I knew he couldn't wait a week for insulin. Diabetics can't just skip doses or delay refills. So I approached him and offered to help. He was so proud, so embarrassed, but eventually he let me pay for his prescription." "How did that feel?" "It felt like the most important thing I'd done since retiring. I realized that all my years of knowledge about medications meant nothing if people couldn't actually access the drugs they needed." Ellen felt her amazement growing. "Linda, since that first time with Roberto, how many people would you say you've helped?" Linda thought carefully. "I keep a journal, not for any particular reason, just to process what I'm seeing. Over 18 months, I've helped about 300 different people with prescription costs." The audience gasped audibly. Ellen stared at Linda in disbelief. 300 people? Linda, that's incredible. What kinds of medications are we talking about? "Everything. Insulin for diabetics, heart medications, blood pressure pills, cancer treatments, antibiotics for children, inhalers for asthma. I've paid for medications that cost anywhere from $30 to $800. Ellen stood up and walked to her desk, returning with a folder, that her producers had somehow managed to compile during their conversation. Linda, while we've been talking, my team has been doing some calculations. Can I share what we found? Linda nodded, looking nervous. Ellen opened the folder. Linda, if you've helped 300 people over 18 months, and you've mentioned costs ranging from $30 to $800, we estimate you've spent somewhere between $50,000 and $70,000 of your own money on other people's medications. Linda's eyes widened. I never really added it all up like that. Linda, that's not just generous. That's life-changing money that you've invested in keeping people healthy and alive. Ellen sat back down. Where does this money come from? Linda looked uncomfortable with the personal nature of the question. From my retirement savings. I had a good career, I saved carefully, and I don't have children or expensive habits. The money was just sitting there while people were suffering. Linda, you're spending your retirement fund on other people's medical care? I can't think of a better use for it, Linda said simply. Money in a bank account doesn't save lives. Insulin does, heart medication does, cancer treatments do. Ellen felt tears building in her eyes. Linda, tell me about some of the people you've helped. Linda's face immediately softened with obvious affection. There's Maria, a young mother with type 1 diabetes who was rationing her insulin because she couldn't afford the full prescription. She has 2 small children, and she was literally risking her life to save money. Ellen was completely absorbed in Linda's stories. And there's James, a construction worker who had a heart attack and needed expensive cardiac medications. His insurance had a huge deductible, and he was choosing between his heart pills and his mortgage payment. How do these people react when you offer to help? Most are initially resistant. They're proud, embarrassed, worried about accepting help from a stranger. But when I explain that I'm a retired pharmacist who understands how crucial their medications are, they usually accept. Do you stay in touch with any of them? Linda smiled. Some of them have become like family to me. Maria brings her children to see me sometimes. James sends me updates about his heart health. I get Christmas cards from people whose names I've forgotten, but whose medication needs I remember perfectly. Ellen stood up again. Linda, I want you to meet some people. From the wings of the stage walked a group that made Linda's face immediately light up with recognition and joy. People of various ages, but all carrying themselves with the grateful posture of those whose lives had been literally saved by unexpected kindness. Linda, these are some of the people you've helped over the past 18 months. Ellen announced. The first to reach her was an elderly man who immediately embraced Linda with obvious emotion. Linda, it's Roberto, he said, his voice thick with gratitude. You remember the insulin? Linda hugged him tightly, tears flowing freely. Roberto, you look so healthy. How are your blood sugar levels? Perfect, thanks to you. I haven't missed a dose in 18 months. A young woman with 2 small children stepped forward next. Linda, it's Maria. These are my daughters, Sophia and Isabella. Linda knelt down to greet the children, who shyly hugged this woman who had kept their mother alive. Maria addressed the studio audience. Linda saved my life. I was skipping insulin doses, getting sicker and sicker, but trying to hide it from my kids. Linda didn't just pay for my medication, she educated me about patient assistance programs and helped me find ongoing support. One by one, people shared their stories with Linda. Heart patients who were alive because they could afford their medications, diabetics whose lives had been stabilized, parents who could focus on their children instead of worrying about their own health. But Ellen had arranged something that would show Linda the even broader impact of her work. Linda, these people represent just a fraction of those you've helped. But there's something else you should know. Ellen walked over to her desk and returned with more papers. We contacted several pharmacies in the areas where you volunteer, and they shared some remarkable information with us. Linda looked curious and slightly apprehensive. Ellen began reading. This is from the pharmacy manager at Medcare Pharmacy. Since Linda Stevens started helping customers with prescription costs, we've seen a dramatic decrease in people abandoning their prescriptions. Medication adherence in our customer base has improved significantly. She flipped to another page, and this from Community Pharmacy Plus. Linda's intervention has prevented numerous medical emergencies. We've had patients tell us that without her help, they would have ended up in the emergency room due to medication non-compliance. Linda was staring at Ellen in amazement. They've been tracking this? Linda, you haven't just been helping individual people. You've been preventing medical crises, reducing emergency room visits, and improving public health outcomes in your community. Ellen handed Linda one of the documents. This is a letter from the Lehigh County Department of Public Health. They want to meet with you about your methods and potentially implement programs based on your model. Linda was reading the letter with tears streaming down her face. But Ellen had more surprises. Linda, there's someone else who wants to meet you. From the audience stood a distinguished woman in a business suit who walked onto the stage. Linda, this is Dr. Patricia Chen, director of the Medication Access Foundation, Ellen said as the woman approached. Dr. Chen sat down with Ellen and Linda. Linda, what you've been doing represents exactly the kind of intervention we've been trying to formalize through our foundation. You've proven that direct assistance with prescription costs can be life-saving. Linda looked stunned to be meeting someone from a major foundation. We'd like to offer you a position as Director of Community Medication Assistance, Dr. Chen continued. You would help us design and implement programs to provide prescription assistance to low-income patients throughout California. Ellen watched this conversation with growing excitement. The position comes with a full salary, benefits, and a budget of $2 million annually to help patients who can't afford their medications, Dr. Chen explained. You'd work with pharmacies, healthcare providers, and patients to create systematic solutions to medication access problems. Linda stared at Dr. Chen. You want to pay me to do what I've been doing for free? Linda, what you've been doing with your own retirement money has proven so effective that we want to scale it up with foundation resources. You'd be able to help thousands of people instead of hundreds. Ellen couldn't contain her excitement. Linda, do you understand what's happening? Your personal mission to help people afford medications is becoming a statewide program with a $2 million budget. Linda looked around at all the people who had come to thank her, at Dr. Chen, at Ellen, trying to process the magnitude of what was being offered. I just couldn't stand watching people suffer because they couldn't afford medicine, Linda said, her voice barely above a whisper. Ellen stood up and made a statement that would encapsulate everything Linda's story represented. Linda Stevens thought she was a retired pharmacist who occasionally helped people buy medications. But what she actually is a healthcare access pioneer who proved that sometimes the most important prescription is compassion, and the most effective treatment is making sure people can actually afford their medicine. But Ellen had one final revelation that would show Linda the true legacy of her work. Linda, there's one more person I want you to meet. A young man in his early 20s stepped forward from the group of visitors, approaching with obvious emotion and purpose. Linda, I'm David Rodriguez. You probably don't remember me, but you changed my family's life 8 months ago. Linda looked at David carefully, trying to place him. My little sister Carmen has cystic fibrosis. Her medications cost over $3,000 a month, and my parents were struggling to keep up with the costs. David's voice grew stronger as he continued. You saw my mother crying at the pharmacy counter when she couldn't afford Carmen's full prescription. You stepped in and paid for the entire month's supply. Linda's eyes began to fill with tears as she started to remember. But here's the most important part. When you helped us, you also told my mother about patient assistance programs and foundations that could provide ongoing help. You didn't just give us money, you gave us hope and direction. David turned to address the studio audience. Because of Linda's help and guidance, Carmen now gets her medications through a patient assistance program. She's healthy, thriving, and able to just be a normal 10-year-old kid. He turned back to Linda. But Linda's kindness affected me too. Seeing how one person's generosity could change everything for a family, I decided to become a pharmacist myself. I just finished my first year of pharmacy school, and I want to help families like mine. Linda was sobbing now, overwhelmed by learning how her simple act of kindness had influenced someone's entire career path. Ellen felt tears streaming down her own face. Linda, do you understand what David is telling us? Your prescription assistance didn't just help his sister. It inspired a future pharmacist who will spend his career helping other families access the medications they need. David added, Linda, you taught me that pharmacy isn't just about dispensing pills. It's about making sure people can actually get the treatments that will keep them alive and healthy. Ellen addressed the studio audience. Ladies and gentlemen, what we're witnessing is the true power of using your knowledge and resources to serve others. Linda thought she was helping people buy medications, but she was actually demonstrating how healthcare access should work, inspiring future healthcare providers, and creating systematic change in how we help people afford life-saving treatments. She turned to Linda one final time. Linda, you've proven that retirement doesn't mean stepping away from your calling. Sometimes it means stepping into it more fully. You took 32 years of pharmaceutical knowledge and combined it with unlimited compassion to create something beautiful, a world where people don't have to choose between medicine and survival. As the show wrapped up, Linda was surrounded by the people whose lives she had saved, the healthcare professionals she had inspired, and David, whose career path had been shaped by witnessing Linda's generosity. 6 months later, the Medication Access Foundation's Community Assistance Program, based on Linda's model, was operating in 15 California counties. Linda worked with pharmacies, doctors, and social workers to identify patients who needed prescription assistance, and the program was helping over 2,000 people monthly access their medications. David Rodriguez had indeed continued in pharmacy school, where he started a student organization focused on medication access advocacy. He gave presentations about the Linda Stevens model of direct patient assistance to future pharmacists throughout the state. And every day when Linda went to work at the foundation, helping coordinate assistance for people who couldn't afford their medications, she carried with her the knowledge that her retirement savings had been the seed money for something much larger, a systematic approach to ensuring that in America, people's health wasn't determined by their wealth. Because Linda had learned something that changed how she thought about money and medicine, that the most important investments aren't the ones that grow in value over time, but the ones that save lives immediately. And sometimes the best retirement plan isn't about securing your own future, but about ensuring that others have a future to look forward to.